Hello, I'm Dr. Stephen Giannopoulos, and I'm here with Dr. Chris Brown from Virginia.
Absolutely.
What town? Tazewell,
Virginia.
Tazewell, Virginia. And I'm so happy to have him here today because he's really an expert in a field that I'm very interested in. So many of our patients are women, right? I mean, women make up a majority of chiropractic patients. They're the leaders in the family as far as healthcare goes. And there are some conditions that a lot of women are experiencing that really don't have a great medical answer. And you've been doing quite a bit of work in this field, so I'm kind of curious as to how you've been working with women and hormonal problems, and what your method is for assessing them.
Okay, so we'll start with, I guess, where I started with it, and that was the same as you. Lots of women in my practice, and I really wanted to find a way that I could help them, and it just wasn't reaching them. I think we have to always start at the point of what is the stressor, right? So no matter what the presentation of the problem is, if it's a hormonal problem, something like ovarian cysts, or infertility, or painful periods.
So those are the symptoms really that we're looking at. We're looking at female symptoms that include menstrual cycle problems as far as pain goes. We're looking at fertility. We know fertility is a huge problem, right?
Absolutely. And then even into things like sugar handling, okay? Things that correlate with sugar handling, like polycystic ovarian disease, even adrenal fatigue, adrenal problems, okay? So they really go hand in hand. So we started a place of first identifying stressor and looking at lifestyle. So it's the Be Fit, Move Right, Think Well protocol, okay? So no matter what implementation you do, what the treatment, if you will, is, it's really all temporary if we don't find the stressor or the cause.
So what you're saying basically is that regardless of what the symptoms are, the approach to helping people who have these conditions is the same as the approach of helping people with many conditions, and that is looking at our nutritional health, looking at our physical health, and looking at our mental health. That's the base.
First and foremost, absolutely. And then with that is our integrity of our nervous system, okay? Because as we know, the nervous system controls, coordinates, and regulates all parts of the body, including the endocrine system.
And the endocrine system, again, being the system that controls the hormones for women and, of course, for men.
Absolutely. So once we have that, and we talk about lifestyle factors, one of the major lifestyle factors is chemical stress, or the foods we eat. Chemical stress, medications, synthetic estrogens, birth control, hormone replacement therapy, things like that. So wait a minute,
you mean to tell me that if you're taking oral birth control pills that could impact?
Absolutely. Absolutely causes dysregulation, or upsets the balance of the normal hormones in the human body. Okay?
Well, so many of our patients are on this medication or birth control pills for really for years.
Absolutely.
And
oftentimes for the things that we're saying it causes, like
in other words, for treating the
ovarian
symptoms,
disease,
exactly.
Ovarian cysts, fibrocystic breast tissue, painful periods. We all have multiple women in our practices that are put on birth control because they have such pain and heavy flow or clotting or things like that with their cycle. And although it will help the symptom, it makes the problem worse.
Okay.
Yeah.
Okay. So now, if we have patients who have been on birth control pills for a long period of time, perhaps they have a problem with obesity or being overweight. Now we're starting to see some vicious cycles start to develop, right?
Yes.
So, and it's been my experience that diet and exercise, although absolutely necessary, doesn't exactly fix the problem. So what are some ways that you use to help the diet, the exercise, the lifestyle approach? How do you assess at what position the patient is in, or at what point they're at?
One of the best ways to really identify, first of all, to back up, what we're looking for typically is a imbalance in the ratio of estrogen to progesterone, okay? And most all these problems come from something called estrogen dominance, okay? And typically what the dominant is that it's not that there's tons of estrogen, although that can be the case. Oftentimes it's way too little progesterone, excuse me.
So you could have symptoms of high estrogen if you have too little progesterone.
Right, because they need to be in a ratio.
because a lot of people think if I just take something that increases my estrogen, my symptoms will be better. For example, soy products and things like that.
Absolutely.
Okay, so you have to dig a little deeper.
Dig a little deeper. So it's very important to do an extensive female health history, and then to look at the areas. And then what we do with the women that we work with is we do something called saliva lab testing. Okay, most people when they think about having their hormones tested, they think about blood work. Okay, and that's an important study. But the difference and the huge difference between having your blood checked for your hormone levels and having saliva checked for hormone levels is that the active hormone, okay, so when it's not connected to a protein, is detected best in saliva and most accurately, okay? So that's one huge benefit of saliva testing, is that it's going to tell you the hormones in your system right now that are functioning. You know, it'd be like if you had a stomach full of food and we tested to see how much food was in your stomach, but your body's not digesting any of it.
Right.
Okay?
Right.
Okay? So even if you have
it's
all
the usable form
the usable form of a hormone, absolutely. And another very important aspect of hormone testing is that you can take it during specific times of the day. Okay? So if you saliva test, things like cortisol should change throughout the day, so you want to check it in the morning, in the afternoon, and in the mid-afternoon and the evening, because they should be at different levels throughout the day.
That's a really important point, because a lot of times we think, oh, my doctor did those tests for me and he checked my blood and my cortisol is normal.
Absolutely.
And the truth is, it's something that increases and decreases throughout the day in a very specific pattern, and the only way to actually check that through your blood is to go for repeated blood draws.